Hello everyone, welcome to this lecture on the factors affecting drug absorption. So then today we are going to gain knowledge of the various factors that affect the absorption, as well as we are going to understand what are these terms such as immediate release or delayed or extended or sustained or controlled release formulations, as well as we are going to understand the transdermal patches. What are these? Okay. So then what knowledge do we have? We know that the pharmacokinetics is the study of what happens to the drug in the body, and there are four principles of pharmacokinetics: ADME, absorption, distribution, metabolism, and excretion. So after a drug it is given, it is absorbed into the central compartment. Okay. And when it is given, first it is liberated in our gut, then absorption happens, and after absorption this drug is available in the central compartment as free drug. Okay. So then what are the various factors that affect the absorption? So the most common route we give a drug is oral route. Okay. So after a drug is given orally, it is absorbed into the central compartment, but before absorption there are various factors that affect the absorption. Okay, so what are these factors? First of all, the drug itself, its particle size, its formulation, it plays a very important role in the absorption. Okay, so we will understand them. Then there is drug-drug interaction, then there is drug-food interaction, then there is the concentration of the drug, okay, as well as if the drug is weak acid or base, and the pH and ionization. All these factors we know about them. All these factors play very important role in the drug absorption, as well as one more important factor is the PGP. PGP, what it is? It is P glycoprotein, one important efflux protein. Okay, it effluxes out the drug. Okay, so we will understand them one by one. Let's start. So first of all, the particle size. We know that the absorption is the movement of a drug from its site of administration into the central compartment, and the most common dosage form is the solid dosage form of the drug. So whatever the drug we have administered to a patient, it should be first dissolution. It should be first dissoluted. Okay, then it is liberated. Okay, so we will understand these terms. What does the dissolution means? What does the liberation of the drug means? We will see them. So whatever the drug we have given, it is first disintegrated into smaller particles. Okay, and these smaller particles, then a solution is formed. Okay, and this process is known as dissolution. So first is it is disintegrated into smaller particles, then a solution is formed. Okay, so this whole process is very important for the absorption. Okay, it is absorbed into the blood or body, or we can say central compartment. What if we will give a drug in the syrup or some suspension form? Of course, then it will be directly available in this form. Okay, so the faster absorption is possible, but most probably we are giving in the tablet form or some capsule form, then it should be first disintegrated, then a solution is formed. Okay, as well as one more important factor that play a role in this process is what are the excipients in the tablet. Okay, what are excipients? Excipients are inactive substances. There are many inactive substances that are added in some tablets. Okay, so these inactive substances are known as excipients, and they also play very important role in this whole process. Now let's see these some tablets I have shared. First of all, the Voveron SR. What does the SR means? SR means sustained release. This Voveron is of diclofenac, and this is a sustained release formulations. Okay, we will understand this term, what is the sustained release, as well as you have seen the pentop DSR, D for domperidone, SR means sustained release. What is this? Okay, it is the capsule, we all know that. Then there is one more important example is that the metXL. MetXL is of metoprolol, one very important antihypertensive. It is an extended release formulation, as well as there is zerodol CR. CR means controlled release. It is of aceclofenac, one important NSAID, just like diclofenac. Okay, and this aceclofenac is of 200 mg. We will see that. Okay, 200 mg, please remember this. So whatever the drug we have given, it should be released from its administered form. Okay, and this is known as liberation. Okay, so the disintegration, then dissolution, then the drug is available. Okay, so this whole process is known as liberation. And various dosage forms, they are available in various release types. First is the immediate release. Immediate release is the most common release form. Okay, most of the drugs are immediate release, means when we have given the drug, it is immediately released without delay. Okay, then there is delayed release. What does it mean? Simply it means that the drug is released after some time. Okay, and most commonly they are entry coated. What does it mean? It means that if we want to give a drug, and we want it to be released in our intestine rather than stomach, then we will do an entry coating. Okay, so it is released after some time in the intestine, so it is known as delayed release. Okay, then there is extended release. It is usually represented as the ER or XR or XL, such as metXL. We saw one. What does it mean? It simply means that the drug is available over an extended period. So we can give the drug once a day. Okay, so suppose if we have to give a drug twice a day, if it is extended release, then we can give it once a day, because the drug is available over an extended period of time. And term extended release is usually used as an umbrella term. Okay, and it can include medications that are both sustained as well as controlled release, such as we saw one aceclofenac. Okay, so aceclofenac zerodol CR was there, and zerodol CR was of 200 mg. Okay, while the dosage of aceclofenac is 100 mg twice a day. But if it is available in the controlled release formulations such as zerodol CR 200 mg, it can be given once a day. Okay, so these sustained release formulations or extended release formulations are very commonly used in our daily practice, and these are very important to understand. One important example of SR is pentop DSR. In it the domperidone is of 20 mg. Okay, the 20 mg domperidone is sustained release because domperidone dosage is 10 mg twice a day, while in pentop DSR it is of 20 mg because it is sustained release. So we can give it once a day, domperidone 20 mg, and it is released over an extended period of time. Okay, I hope you all got it. These terms are really important to understand. Now we will see one more important thing. I have taken this from the Mayo Clinic website. There is the guideline. It says that do not take iron supplement and antacids or calcium supplement at the same time. Why is this written? Why it is saying such thing? We have to understand it because iron deficiency is very common, especially in women. So we have to understand, if we want to prescribe iron to some women or some man, we have to understand this, that we should not give antacids or calcium supplements at the same time. There should be a dosage space, means there should be a gap between these two drugs of 1 to 2 hours. It is written here. Why it is so? We will understand that. Okay, this is known as drug-drug interaction. We will see that. First of all, let's see this disease. This is known as chlamydia. Okay, it is a very common STD. It is a sexually transmitted disease, very common. And one very important drug, which is a drug of choice for this infection, is tetracycline. Okay, so the tetracycline is a very common antibiotic, a very old antibiotic also, and it is used for this chlamydia infection. So similarly, such as of iron, it should not be given with some calcium or antacids. Same is with the tetracyclines also. So we will see that. So then tetracycline and iron should not be given with calcium and antacids. Okay, very important drug-drug interaction, because we give iron very commonly, as well as we use tetracycline also in our daily practice, and tetracycline have very high affinity for polyvalent cations. Okay, such as calcium. Calcium is a polyvalent cation. Antacid contains aluminium and magnesium cations. So if we will give tetracycline with these, it will form chelates. Okay, there will be a chelation. Okay, so it will form insoluble complexes. So the tetracycline as well as iron with calcium and antacids, they form insoluble complexes, and these insoluble complexes are poorly absorbed. Okay, so they should not be given with each other, and this interaction is known as luminal effect, because it is happening in the lumen. Okay, it is known as luminal effect, and there is formation of insoluble complexes of these. Okay, so they should not be given with each other. There should be in an interval of 2 to 3 hours between them. Okay, now we will see one more important drug-drug interaction. It is the gut wall effect. We know the drug cyclopam. It is very commonly used for abdominal pain, because it contains one very important antispasmodic. It is known as dicyclomine. The dicyclomine is anticholinergic, and it have antispasmodic activity. What does this anticholinergic means? In the parasympathetic nervous system, when it is activated, you are relaxed. Okay, and when you are relaxed, your digestive activity is active. Okay, so when the parasympathetic nervous system is activated, you are relaxed, your digestion is activated, and there's peristaltic movement, means peristalsis is happening there. Okay, and one important neurotransmitter of the parasympathetic nervous system is acetylcholine. That is why it is known as cholinergic nervous system. Okay, so parasympathetic nervous system is the cholinergic nervous system, and when the cholinergic nervous system is activated, then peristalsis is happening. And when peristalsis is happening, and if there is some infection in your gut, then this peristaltic movement, it feels like spasm. Okay, so we want this spasm to stop, so we give anticholinergic, and one important anticholinergic is dicyclomine. It is antispasmodic. Okay, as well as morphine is also there. So the anticholinergics as well as morphine, means opioids, these drugs decrease the motility of the gut. Okay, so if they will decrease the motility, then they will have effect on other drugs. If you have given with them, okay, they will have effect on those drugs. Their absorption will be affected. Okay, while if we will increase the motility, such as metoclopramide, it is used for nausea. So it will what? It will increase the motility. So if it will increase the motility, then it will also have effect. So these drug interactions are also very important to understand, and it is known as gut wall effect, because these drugs have effect on the gut wall. Now we know that the weak acidic drugs as well as weak basic drugs are ionized into ions such as Ha into H plus ion and A minus ion. Here B and H plus ion will form BH plus ions and they remain in equilibrium with each other. Okay, and only the Ha and the B are lipid soluble, so they will cross the lipid membrane, and this ionization is affected by the pH. Okay, so whatever the pH is there, it will have effect on this ionization and it will have effect on the absorption of the drug. We know that. Okay, so we saw the particle size, we saw the liberation process, we saw the extended release, sustained release formulations, we saw the drug-drug interactions. Now, one more point I would like to add, that suppose if lady is suppose anemic as well as she is also suffering from osteoporosis, and you have said to her that she should take iron as well as she should also drink milk, and if you have not told her and if she is taking the iron supplement and milk with each other, then milk contains calcium and the calcium and iron will form insoluble complexes, and there will be a improper absorption of iron. So you have to tell her about this drug food interaction. Okay, as well as the drug concentration, it will have effect on the absorption. Weak acid and bases, we all know that now. And the PGP, we know that it is a very important efflux protein. Now we will see, this is IV route. Okay, so if we will give the drug by the IV route, it is readily available in the central compartment. But what if we are giving a drug, suppose in subcutaneous or IM route? These are some our most common routes. Okay, oral or IV or IM or subcutaneous, we all know about them. Okay, so if we are giving a drug by subcutaneous or IM route, then what will happen? Subcutaneous route or IM route, which one is faster? IM route is faster. Subcutaneous route is slower than IM route, but both are generally faster as well as consistent, okay, than oral route. Okay, so the subcutaneous route and IM route, of course, lipid soluble drug, it should be a lipid soluble drug to pass, as well as subcutaneous site is slower than IM route. And if we will apply some heat or there will be some muscular exercise, then this will increase the blood flow, so faster absorption. Okay. But what if we want to retard the absorption? What can we do to retard the drug absorption? So then one important example is of lignocaine. Lignocaine is a local anesthetic and it is used in some surgeries, minor surgeries, and if we want to put sutures here, okay, so what we do, if we want to put sutures here, then we will anesthetize this area, okay, and we use the lignocaine for that. But what if we want to retard the absorption of lignocaine? What we do, we will use the adrenaline. Adrenaline is a symptomimetic as well as is have vasoconstrictor activity. So when adrenaline is given with the lignocaine, then it will decrease the absorption of lignocaine into the systemic circulation. Okay, so the systemic absorption of lignocaine is decreased, and because of that the systemic toxicity is also decreased. Okay, as well as because of the vasoconstriction, bleeding will decrease. Okay, so adrenaline will have three effects. First, it will decrease the systemic absorption of lignocaine, as well as it will decrease the toxicity of lignocaine, as well as it will decrease the bleeding from the site of injury, okay, or some surgery, minor surgery. Now we will understand one very important transdermal drug delivery system. What really happens is that if we apply a drug topically here, it will diffuse through the stratum corneum, okay, then it will diffuse to the epidermis, then the dermis, and it will migrate to the capillaries here, and it will reach into the systemic circulation, and it will reach to its site of action. Okay, this is known as transdermal drug delivery system, a very important system to know. So then there are various drugs that are available as transdermal patches, such as hyoscine, fentanyl, or GTN, or nicotine. First of all, the hyoscine. Hyoscine is also known as scopolamine, and scopolamine is a very commonly used drug for the control of motion sickness. Okay, and this was the first drug to be marketed in the form of transdermal patches. Okay, as well as there are other drugs such as fentanyl, GTN. GTN is glyceryl trinitrate, and Nicotex or nicotine. Okay, so these are some very important examples of transdermal patches. The main advantage of transdermal patches is that they maintain a constant plasma level of the drug, okay, because they diffuse constantly from their patches. Okay, so if a drug is very fast metabolized in the body, what we will do, we will apply a transdermal patch. It will be released slowly, it will have effect constantly, and a constant plasma level can be maintained. Okay, so suppose if we are going through some C route, and if we want to give a motion sickness drug, then we can use scopolamine in the C sickness. It will have a continuous effect, okay, as well as if some patient is suffering from angina, and there are chances of anginal attack, then we can use this GTN patches. Okay, all these are examples are there. Fentanyl is an opioid, it is used for pain. Nicotex, you all know about it. So all these are very important examples of the transdermal patches. Thank you. Do subscribe, like, and share if you loved the lecture. So what knowledge we gained today? We now know about particle size, the drug formulations such as sustained release, extended release, controlled release, various drug-drug interactions, the presence of food, concentration gradient, weak acidic and basic drugs, pH and ionization, PGP. All these are various factors that affect the drug absorption, as well as we saw the luminal effect and the gut wall effect. We saw one very important example of adrenaline and lignocaine, as well as we understood the various transdermal patches such as of hyoscine or scopolamine, fentanyl and opioid, GTN, a vasodilator which is used in angina, and nicotine, Nicotex. Okay, we use that. So now you have an assignment: why inactive substances or excipients are used, where are the transdermal patches applied. Please share in the comment section. These are the references. Thanks a lot.